Several mental disorders can contribute to excessive or uncontrollable anger. Some of the most common ones include 1. Intermittent explosive disorder, IED, characterized by sudden, intense outbursts of anger or aggression that are disproportionate to the situation. 2. Borderline personality disorder, BPD. Individuals with BPD often experience intense mood swings, including episodes of extreme anger, sometimes called borderline rage. 3. Bipolar disorder. During manic or depressive episodes, individuals may have difficulty controlling their emotions, leading to irritability or explosive anger. 4. Oppositional defiant disorder, ODD, primarily diagnosed in children. ODD involves frequent anger, defiance, and hostility toward authority figures. 5. Conduct disorder, CD, found in children and adolescents. CD includes aggressive behavior, a disregard for rules, and frequent outbursts of anger. 6. Post-traumatic stress disorder, PTSD. Trauma survivors may experience irritability, aggression, or angry outbursts as part of their symptoms. 7. Attention deficit hyperactivity disorder, ADHD. People with ADHD may struggle with impulse control, leading to frustration and angry reactions. 8. Depression. While sadness is the primary symptom, some individuals, especially men, may express their depression through irritability and anger. 9. Narcissistic personality disorder, NPD. People with NPD can become easily angered, especially when they feel criticized or their self-image is threatened. 10. Substance use disorders. Alcohol or drug abuse can impair emotional regulation, leading to frequent outbursts of anger or aggression. If anger is interfering with daily life, relationships, or work, seeking professional help from a therapist or psychiatrist can be beneficial. Anger can have several disadvantages, affecting various aspects of life, including mental health, relationships, and physical well-being. Some key disadvantages include 1. Mental and emotional effects. Increased stress. Frequent anger can raise stress levels, making it harder to relax or think clearly. Depression and anxiety. Uncontrolled anger can contribute to or worsen mental health issues. Regret and guilt. Acting out in anger may lead to feelings of guilt or shame afterward. 2. Physical health risks. Heart problems. Chronic anger increases the risk of high blood pressure, heart attacks, and strokes. Weakened immune system. Stress hormones released during anger can weaken immunity, making you more vulnerable to illness. Sleep issues. Anger and frustration can lead to insomnia or poor sleep quality. 3. Relationship problems. Conflicts and broken relationships. Frequent outbursts can push loved ones away and damage friendships. Workplace issues. Anger can lead to conflicts with colleagues, poor teamwork, or even job loss. Parenting struggles. Parents who frequently express anger may negatively impact their children's emotional well-being. 4. Poor decision making. Impulsive actions. Anger often leads to rash decisions that can have long-term consequences. Legal and social consequences. Uncontrolled anger may result in legal trouble, such as violence or road rage incidents. 5. Negative reputation. Perceived as unapproachable, people may avoid someone known for their temper. Damaged trust. Others may be hesitant to rely on or confide in someone who often gets angry.